and in succession to the videos what I have been discussing in general pathology and general surgery. So today we'll be looking at the important differences between bacteremia and septicemia. So students and viewers, beginning with bacteremia, it is the presence of viable bacteria in the circulating blood. So actually in the condition of bacteremia, this is a the word itself is suggesting that it is only the presence of bacteria what is present in the bloodstream. Whereas in the condition of septicemia, it is a clinical name for blood poisoning by bacteria. So actually in the condition of septicemia, what do we find is that along with the presence of blood, along with the presence of bacteria in the blood, there is presence of the toxic products or the poisonous products what are being released by the bacteria in the bloodstream. So this was the first difference. The next important difference is the simple presence of bacteria in the blood is called bacteremia, whereas in the condition of septicemia, what do we find? The presence and the multiplication of bacteria in the bloodstream. So do remember, in the condition of bacteremia, what do we find? That there is only presence of bacteria what is flowing in the bloodstream. But in the condition of septicemia, what do we find? That the bacteria are not only present in the bloodstream, they are also in the process of active multiplication. So the blood in the bloodstream, not only the bacteria are flowing, they are in the stage of active multiplication. So that becomes the condition of septicemia. And apart from the multiplication of bacteria, they are also going to produce the toxic elements or the toxic compounds, the poisonous compounds into the bloodstream through the multiplying. So since the bacteria are multiplying, they are also releasing the toxic poisonous products into the bloodstream in the condition of septicemia. Now moving on to the next important condition, that bacteremia, it is simply the presence of bacteria, so it is not that dangerous. So bacteremia, the condition is not that dangerous, but the condition of septicemia can be very life-threatening, because if the condition of septicemia, if the presence of toxic elements are there, if it is not controlled through proper antibiotic therapy, so the condition can be even life-threatening. So viewers, do remember that bacteremia, it is not dangerous, whereas septicemia is life-threatening. Now, in the condition of bacteremia, there is lesser number of bacteria in the blood. Whereas when we compare the condition of septicemia, we find that higher number of bacteria are present in the blood in the condition of septicemia. Now moving on to the next important difference, the point of differentiation, that in bacteremia, the cause is due to any kind of a wound or any kind of an infection, or through normal surgical procedure, or either it can be an injury. So the bacteria gains access into the blood through 3-4 reasons, such as wound, infection, injury, or through a surgical procedure. In the condition of bacteremia, of septicemia, what do we occurring from the occurs from the infection throughout the body, including the infection from the lungs, abdomen, and the urinary tract, or even it can be skin infections. So in the condition of septicemia, what do we find? That the bacteria are gaining access into the bloodstream through any of the major vital organs, that is lung, abdomen, urinary tract. If it is an infection of the major systemic major vital organs of the body. So if from the condition of septicemia is arising, if the infection is already present in any of the vital organs of the body, if that bacteria are not being controlled, so they will gain access into the bloodstream and they will start multiplying and produce the poisonous substances into the blood. Now moving on to the next important point of differentiation, that bacteremia, it does not produce toxin, whereas this condition of septicemia produces toxins. Now next important point, that is in the condition of bacteremia, it does not produce symptom. So in the condition of bacteremia, the patient is going to have develop no any symptoms. But in the condition of septicemia, since the poisonous elements, the toxic poisonous substances are being released into the blood, so that was going to cause a considerable symptoms can be seen, such as chills, fever, very fast respiration, and heart rate, it can be seen. Now moving on, the next and the very important last point of differentiation is is that the condition of bacteremia, what is happening is that the immune system can clear out the bacteria. So then the condition of bacteremia, what do we find is that the body's immune system is well capable enough to fight the bacteria which are flowing into the bloodstream. So our immune system can clear the bacteria in the bloodstream in the condition of bacteremia. Whereas in the condition of septicemia, what do we see is that actually the treatment needs to be started for the toxic elements, toxic poisonous products. That is, antibiotics are important in treating septicemia. So students and viewers, this was a very short discussion where I have given you in simple terms the important differences, that is, between bacteremia and septicemia. If you still have any queries or comments, or there are certain topics what you want it from me to be discussed in Hindi or in English, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.